My name is David Gonzalez. I am an SI tutor for anatomy and physiology, working for the Office of Student Success. What we're going to be talking about today is about the autonomic nervous system and pretty much the two branches that consist of it, which are the parasympathetic, also known as the rest and digest, and the sympathetic, also known as the fight or flight. Okay, here what we see is a preganglionic axon, which is releasing acetylcholine. Acetylcholine stimulates the postganglionic axon and releases acetylcholine on different organs, the lungs, the intestines, the heart, and pretty much the parasympathetic system works more as a downer. The sympathetic system, on the other hand, also known as a fight or flight, consists of a preganglionic axon, which is going to release also acetylcholine, but the postganglionic axon is going to release epinephrine or norepinephrine, which is represented here by the green dots. Another way that the sympathetic works is by the preganglionic axon releasing acetylcholine into the adrenal medulla, which directly releases epinephrine and norepinephrine into the blood vessels. This, which is represented by this part right here. This would be a type of artery, and the release of the epinephrine happens here and organs around. Also, the epinephrine here is released in pretty much axon organs. Here I'm going to show you a little bit of what the parasympathetic does. Parasympathetic increases salivation, and as we know, the rest and digest, as it is known, is going to increase salivation because we need saliva whenever we're going to eat, and for digestion, we need that salivation to happen. Pupil constriction, it's not really needed in a situation where we're going to be eating. It's not an emergency that we have to be very watchful of what's going on. The decrease in the heart rate is because there's no stimulation. The heart is stimulated by epinephrine and norepinephrine, which is released by the sympathetic. So if there's no big action going on or anything, the heart rate can just be at its normal levels. The intestinal movement, of course, is going to be increased because of the digestion. It needs to happen. The food we intake, the nutrients have to be taken in. So we are going to have a lot of intestinal motility. Bronchial constriction is going to take place because there's no, like I said, there's no emergency going on. There's nothing big, so the body is not really in that big need of oxygen levels. Now, on the other hand, when we start talking about the sympathetic system, there's a decrease of salivation because there's no need for blood or anything to go right now to salivation, because in an emergency or in situations of action, you're not going to stop and eat. The pupil dilation is going to happen, and this is because we have to be more watchful of our surroundings. We tend to be on the lookout of things whenever we feel anxiety, or that we feel threatened, or we have to make a run or something of action. There's going to be pupil dilation. The heart rate, of course, is going to be increased, and this is because needs to be more perfusion of blood through the whole body, and this is in order to deliver the oxygen that is needed by the heart-working skeletal muscles at the time of running or of something of action. The muscles are going to be working hard, so therefore they need the oxygen to be carried into the muscle cells, and the carbon dioxide that is being released needs to be taken out, which leads us to the bronchial dilation. Okay, let me go to the intestinal movement. There's going to be a decrease of intestinal movement because at the times of emergency, like I said, we're not going to be eating. We don't need to have the intestines working at a time that is not needed. We don't want to start having that sensation of that we need to go in times of emergencies. Bronchial dilation, like I said, is going to happen for the same reason, because since there's being more blood being perfused, there's also more oxygen that needs to be taken in. So therefore, the bronchial dilation in the lungs is going to acquire more space for intake of oxygen, and as well the release of carbon dioxide, which is not needed by the heart working muscles. And pretty much this concludes my presentation on the autonomic nervous system and its two branches, the parasympathetic and the sympathetic. Hope it helps you. Thank you very much. My name is David Gonzalez. I am an SI tutor for anatomy and physiology with a department of student success. Thank you.